Good afternoon, friends. David Wright, and I'm your host of the Disruptive Innovators, Champions of Digital Business podcast. And this afternoon, I'm lucky enough to be joined by Paul Arguinchona. Paul, good to have you on.
Well, thanks, David. I appreciate it. I appreciate the invitation.
Yeah, Paul, get started, maybe you could tell our listeners a little bit about your current role.
Well, currently I'm the Chief Information Officer for Frontier Behavioral Health in Spokane, Washington. And Frontier Behavioral Health is a behavioral health services provider that provide services to our clientele in the greater Spokane County area. We have roughly 17 locations, and we provide both outpatient and inpatient services across multiple program areas, and also provide support for the new 988 National Suicide Line through our regional crisis line services.
More than ever with everything we had going on, COVID and the pressure that put on people. So I'll look forward to hearing a little bit more about your guys' mission and vision. We like to start the episode though with one piece of actionable advice that you might look to give our listeners today.
Well, I was thinking that was a good question. I was thinking about it. And I guess a lot of people tell you to, go out and find a mentor.
Mm.
Well, I'd like to put some parameters on the mentor side of things. What you want to do is you want to find somebody who cares about you, somebody who loves you, who's not necessarily directly involved in your business or does not necessarily do business with you. And that is more concerned about investing in you than what they can get out of it. And now, granted, that is much easier said than done, but that effort will go a long way to benefiting anybody in their career and in their life. I'm fortunate to have a few men in my life who provide that for me, and as a good friend of mine says, they love me enough to stab me in the front.
Mm. Yeah, I love that. Yeah, and as you were saying it, I'm realizing that, I do have a couple folks in my life, and mom did a really good job of promoting kind of relationships like that. And another guest that we had on a little while back, Lee Milligan, had mentioned kind of, yeah, the importance of having someone to really be able to hold up that mirror for you, and someone who you love, who you have that love with, where there's just an appreciation for what they have to say, be it good, bad, or indifferent, right?
Mhm.
So,
Yeah,
or not even good or bad, but just what it is. So
yeah.
great advice. So Paul, maybe we could go backwards a little bit. Could you tell everyone a little bit about kind of how you started out and how you got to be the CIO of a large behavioral health practice today? Yeah.
Yeah, well, I guess my start with computers was obviously back in my undergraduate days, and took a couple of programming classes, COBOL and Fortran, and thought this is interesting, but it didn't really stir my cocoa. And I kind of thought, this is kind of not something I'm interested in,
Mm.
and ended up getting a bachelor's degree in economics. And at that time, that was way back in the mid '80s, and the economy wasn't great, and ended up going over to the Seattle area and to look for a job, and was offered a position selling computers. And I took it because it terrified me, and showed technical aptitude. Worked for a small little outfit who was selling clones and gray marketing IBMs back then. And as I said, showed technical aptitude. So the boss said, okay, you need to make sure everything works before it goes out the door here. And did that, and then took over as a service manager and kind of launched me there. Moved back to Spokane after a couple of years in a service management position, got into networking with Novell, became a systems engineer, and it's just kind of morphed through the years to start a couple departments and run them. And then about a little over 10 years ago, Frontier was having trouble with an electronic medical record implementation, and I'd actually run through some processes way back in year 2000, helping another large clinic in the area get through some Y2K problems.
Wow.
that the difficulties there really paralleled what Frontier was going through. And so they decided to hire me, and we got things settled down as much as possible, reasonably possible, in about a 6-month period. And just kind of moved along from there, and are currently helping to manage the solutions and implement new technologies that are beneficial for our clinical providers who take care of our clients. And in behavioral health, we use the term client instead of patient, because patient has a stigma.
Mm, yeah. Yeah, I like that. I think my mom uses the same terminology. Uh, so, Paul, I want to ask you, and I mean, you touched on a really good one to kind of start the episode with the advice you gave our listeners, but along the course of your journey, personally, professionally, and otherwise, what's one of the most important things that you learned along the way, and what was life like before learning it and after learning it?
Well, early on, I was really kind of delving deep into the technology side, because there was kind of a gee whiz factor to it, and my now late father-in-law told me way back when. He said, "Hey, it's all about relationships,"
Mm,
and that's something that I heard and have really learned that it really is, because in the 30 plus years I've been doing this, the technology's all changed.
right.
And what you find is uh, the relationships of value and the ones you can count on, and they end up being very beneficial, sometimes in the near term and sometimes in the long term. I have some professional relationships that are well over 20 years old, that are still very beneficial today, and the technology's all different.
Right. That I that I actually tell my team about how, for me, it's about building the relationship first. Um, yeah, obviously we'll share our experience, and then if our experience can be of value at some point, great. Otherwise, maybe there's something else we can do. Maybe it's not even in relation to the work that we're doing. Maybe it's a great mechanic near where they live or whatever, but it's about the relationship first. So I love that. I'm interested in knowing too, like, how did you, because you were clearly became a very technical, a high technical aptitude, and as you stepped into a CIO role, how did you grow your operational understanding and your understanding of people and all of that? You know, because I feel like a lot of the CIOs that came up, through a similar track, some of them really struggled with that, but it seems like you're kind of thriving in that arena. So I'm just interested in learning more about maybe some of the things that you did to really step into that leadership role.
Well, one of the things uh, I like to say is I prefer a technical problem over a people problem any day, because I know I can solve the technical one. The people
Right.
one, not necessarily. But that being said, going back to the advice from my father-in-law, it's all about relationships. And I've always cared about people, uh, and to make sure that they're doing well, things are going well for them, because in making sure things are going well for them, a good work life doesn't necessarily translate into life outside of work,
Mm,
but a good life outside of work translates in.
mm,
And if we can, uh, show people you care about them more than just what they're providing for you as an employer, a coworker, there's benefit to that for them. And sometimes you end up you know shouldering helping them shoulder their burdens, and just showing them that you care about them, and that makes a big difference. And it also provides opportunity. In some of the positions I've had, I've been able to basically see an individual doing something and thinking, that individual could step into this role for us here and do really well. And I've done that a few times for a few people over these several years, and they've thrived, and it's been really professionally rewarding and personally rewarding to see them do so well and to step into something that I thought that they could do, and they've done really well.
Yeah, that's fantastic. I'm glad I asked that follow up because that was a great soundbite too. Um, so, Paul, now I want to ask about one of your biggest challenges over the course of your career. So, a time that you may have failed or were challenged, but you took away a big lesson from it. Obviously, in IT and digital, we've all failed plenty of times, but is there something that sticks out in your mind as something where it was a very impactful for you as a business professional?
Looking at some of the failures, I've been fortunate. I've never had a catastrophic or cataclysmic failure from an IT standpoint. I tend
Knock
to
on wood.
look at solutions and look at some of the newer things out there. Um, Granted, all that glitters isn't gold, and you don't become a big fish by going after every shiny little object. But there was a time where we were looking for and I'll be general because I don't want to lay anybody out here, looking for a security related solution, and found a vendor. Well, in my discussions with the vendor, they were relatively new in the marketplace. They misrepresented what their product could do.
Mm,
And that misrepresentation was something that was untenable for us. And we couldn't stick with the product. So we had to abandon it. Fortunately, now it's not a small number, but it was only about $60,000. It's not a multi-million-dollar failure or anything like that. And so what I learned from that was reestablished in my mind, is make sure you get references and that you can check on things. In particular, when something is quote unquote new,
mm,
maybe be a little more careful and breathe a little bit. Now, with that being said, I've still jumped into some very kind of newer technologies and things like that, and they've tended to work really well. But just, you know, be careful of those some of those shiny objects. They
yeah.
might be hooking them.
Or those shiny salespeople, right? I mean,
Yeah, yeah.
well, I'll be interested in learning more about some of those new solutions that you guys are using, and I want to get into that. So before we get into what you guys are up to now, um, like to ask favorite book or literary piece, either that you're reading now or all time.
I'm between books right now, so there's nothing I'm into right at the moment. But a couple of my favorite books. One of your previous guests mentioned the Checklist Manifesto,
Right.
and I think that's a great book. I think anybody in IT or anybody in management should read that thing. Just the case background and how it came about is fascinating and very beneficial. One of the other books that is on my list, and I actually kind of broke it down and utilized it to help train my staff, is a book called "What's Best Next" by Matt Perman. And what I did is I took that and utilized the concepts in that to tie the mission at Frontier Behavioral Health back to what all my staff do each and every day.
Mm,
And by taking those in, because we always have priorities or tasks that we need to do.
right.
And there are the different ways to look at those tasks, or how much time are they going to take, or what is their priority. And so you're obviously going to do the higher priority ones first. Well, but you also have to weigh how much time that task is going to take. And if you have between those tasks, there's what I like to call the interstice or the space. And I kind of get that idea from, in between your ribs, there's an interstitial muscle that helps you breathe. And it's a small little space, but they're important. Well, if you have your tasks lined up in the priorities, and then as you go through your day, you'll have these little spaces of time.
Right.
What's a small one that's a high priority that I can slip in between these two larger ones to get that done? And how does that tie into what we're trying to accomplish to take care ultimately of the clients we serve?
Yeah.
And I thought it was very, very beneficial. I think they got a lot out of it. I know I got a lot out of it. So that's why I recommend that book. I think it's excellent. Between that and
Yeah.
the Checklist Manifesto, and then another book by Peter Block called Stewardship, which I read 20 some years ago,
Hmm.
was another great one.
All right, I'm gonna check all those out. I tell folks this is how I build my my book list. So, thank you. So and it's actually a great transition, Paul, into kind of the next part of the episode, where I'd like to learn more about really the vision for frontier behavioral health, and then past that, how your vision for IT and digital kind of has matriculated from that.
Well, I'm a pretty simple guy. The vision for Frontier Behavioral Health is to provide the greatest ability that we can by keeping technology out of the way of our clinicians doing their job to take care of our clients.
Mm,
Because the technology really is there for reference and to capture information. And then obviously we capture that information, process it, and that allows us to bill and report. So we're compensated for the services that we provide to our clients, so we can keep the doors open and keep providing services. So it's not something where I want to, where I pound the desk and say, hey, technology is the answer here. No, technology is simply a tool to help support our clinical staff in taking care of the clients, because that's what ultimately we're about, and that's the reason I have the job. It's to take care of the clients. I just don't do it directly.
right. Yeah. Um, I love that. And then that's one of the reasons I work so feverishly with healthcare organizations, is because, if I can play the most minute role in helping them serve the clinicians that serve the patients, it's making me a part of something greater than just IT and digital business consulting, right? It's and it's great to be a part of a great mission like yours. Um, so let's talk a little bit about some of the key initiatives that you guys are focused on right now as an organization in IT.
Yeah, a few of them. We're continuously expanding our what I will call our service portfolio, our program portfolio, and a lot of our a good portion of our staff is outbound, so they're out in the community.
Hmm.
And one of the challenges we've historically had, um, there's not the in behavioral health. It's sure it's healthcare, but it's kind of and I don't mean this in a bad way. It's kind of a little bit the redheaded stepchild. It's not compensated as well as other areas of healthcare, and so that makes it finances are tight. And because finances are tight, as we sit here in a capitalist market, the greatest application development is done for like electronic medical records for primary health care and specialty care,
Right.
and not so much in behavioral health. So when I came in, they had an application that they took 4 years to launch for a new electronic medical record after they signed a contract, and that was a little too long, and it wasn't working very well. Now, the application itself did have some drawbacks, but one of the other challenges was staff wasn't trained well on it. And one of the things I've learned doing this stuff for several years is a lot of the times what you want to do in some type of integration or implementation, you want to take your workflows and your processes and you want to take a new application and you want to go like this.
Right.
A lot, the vast majority of initial and sometimes secondary or tertiary electronic medical record implementations is, this is how we do things like this, and here's your application, and it goes like that. And this flails. So the challenge is to keep this open and determine, what do we need here? This is the application will give us 80% of what we need. Let's meld those together and see how the application can support us and where we need to tweak our workflows and make those a little more usable for the application, so we can get this out of the system what we can, because no system's perfect. And we're currently in the between the RFI and RFP process, looking at some options for electronic medical records right now.
Oh, cool. Yeah, I mean, I've worked with this one EMR in behavioral health, which I won't name names, but they won't open their APIs on the back end to allow for, analyzing the data. So you literally have to just like, download raw data and put it in SQL, and like, it's just like this whole rigmarole,
Mm-hmm.
and then they charge you for it, or there's like a certain connector you can get, like it's just
Yeah.
so
Well, yeah, I've had a lot of experience in those areas. And one of the things they're really pushing through the Cures Act is interoperability. And there's, quote unquote standards, and then there's standards. Well, whose standard are you using?
right,
Because those standards don't, not everybody follows the same steps in the standard, and it's making the interoperability, the connectivity, and the ability to extract and utilize data the way you need to very challenging. So
right,
I hear you.
like fire standards, exactly. um so what's what would you say is one of the biggest challenges that you guys are facing as an organization today, either, within IT or just as an organization in general?
Well, I think one of the things we've all seen coming, you know, even a little bit before the pandemic hit, was the uh, staffing. And
Right,
we've always been a little bit behind again. And that goes back a little bit to the compensation model they have for behavioral health. We have a lot of, we do have some uh, psychiatrists and psychologists, very highly trained people, but the bulk of our staff are uh, master's level and behavioral bachelor's level clinicians,
right.
and their compensation isn't fantastic. And that makes it a challenge for us, because we can't compete with some of the large hospital systems in that area. So keeping staffing levels up to where we would like to have them is difficult. The pandemic has just kind of exacerbated that and
Yeah.
made it even more difficult. I've been fortunate in my department in IT. We've had very little turnover in the 10 years I've been there, and
Wow.
several staff who've been there longer than I, which is really beneficial, because they know what rugs certain things are swept under. So
I like that you went there instead of the what I would have said.
yes, I know. That went through my mind.
uh how about any additional uh best practices that you might, offer to our listener? I mean, you've covered uh a few, but any practical best practices that you're and your team are following that are worth mentioning?
Well, I think there's a lot out there, and you can look at different standards and a lot of the compliance items and things like that. And in healthcare, the big one's been HIPAA,
Right.
and everybody talks about, oh, is your application HIPAA compliant? Is this HIPAA compliant? There's no application that's HIPAA compliant. they can support compliance, but they're not compliant in and of themselves. It's
Mm,
a compliance is a process, and no application is quote unquote HIPAA compliant. It's how you choose to utilize it.
right.
And so you can look to those. I like to look at the a lot of the ISO standards or NIST standards that are put out there, and then kind of utilize what is of benefit, and not just quote unquote meet a standard, but raise the bar a little bit to make it a
Mm,
little bit better. Because in that way, if the standard changes and goes up a little bit, you don't have to panic so much and make an adjustment. But the NIST standards and security and stuff, it's getting better. The biggest thing is not necessarily which standard you follow. It's that you follow something and that you educate your users. Because the biggest there's a kind of a funny little saying going around in the information security industry, and it's I found our two greatest threats. First one is everybody outside the organization, and the second one is everybody inside the organization.
yeah.
And it's really true. And the our outside threat is usually malicious. The inside threats are usually ignorant, and that's trying to dispel the ignorance through training and awareness and things like that is a big challenge. And if there was a real good best practice to indoctrinate people in best security practices, man, I'd use it, but I haven't found it.
Yeah, I hear that. I did, you've touched on security a couple times, and I mean, of course, because, it's important to everyone right now, but particularly, mid-market kind of healthcare companies, I feel like are particularly vulnerable to attacks right now. Um, and Saket Modi, he founded a company called Safe Security, and he moderated a panel at one of our events we just did, and he was talking about how, because oftentimes you'll bring security initiatives to a board or your executive fellows, and they'll be like, well, what's the ROI, right? Because that's what they usually want to know from you know IT. It's like, all right, well, what's our ROI going to be, right? And it's like, and even myself, admittedly, because I'm not a security expert, really. That's not my like expertise, and I feel like security experts oftentimes are going pretty deep into that. But anyway, just that a lot of people would struggle with that question, and like the way that they're positioning it now is like, and I imagine a lot of folks, maybe you guys did this as well, but you know, assessing your risk profile, right? So like what, and that is difficult, right? So to do that without an application, and I guess I suppose there are frameworks you could probably do it with, and it would be a tedious process, but this platform can kind of measure your risk very seamlessly in a matter of days as opposed to months. Kind of give you a grade on that, and then basically um, once you quantify what that risk looks like, also quantify what an attack would look like, from a financial standpoint, and then and then we bring that, and that's the ROI. It's like, so, or rather the risk tolerance. Are we able to tolerate this level of risk, knowing that it will cost us this many millions of dollars? If we're comfortable with that level of risk, then we stay where we are. If we're not, then we might need to invest in a few changes, right?
Yes.
I don't know. I just thought that it kind of helped me think through a few things and positioning security initiatives and that sort of thing. So
Yeah. Before those applications were out, we used to do that on a spreadsheet. Take your assets and utilize those and define what they are, and it helped a lot. And way back when, we didn't call it ROI, we called it Rosie return on security investment.
mm,
So somebody's been around a long time may remember that phrase.
love it.
But yeah, and those are the things. And then you have some of the newer I shouldn't say newer, it's been around for a while, but is the factor analysis of information risk, which is really gets down into it and gets down into the dollar values and different things like that. And I'm no expert on it. I know a few people who are, and that's another great way for larger companies to evaluate their risk and make that measurement and make appropriate decisions on where their risk is and what's worth protecting and at what level.
Right. Very cool. Um, what about some of the most innovative things that you guys are doing as an organization, or things that are on the horizon that you might be excited about? I know with tight margins and budgets, and so I imagine money's always an issue, as it is for many behavioral health companies that I know of, at least. But anything that you're excited about on the horizon, or that you guys are doing right now?
Well, I'm always looking to, uh, you know, minimize our costs or not have expenses expand tremendously. And we've had one of the big ones, and jumping back into the security realm, is email security and
Hmm.
minimize phishing emails and uh, phishing attacks and different things, and whaling for the executives and things like that, and finding companies that can do that and really outsource a lot of the work. So I don't have to add staff, and it's something that they can do and provide 24 by 7 by 365 coverage. Where me with my current level of 22 staff and everything we're covering for the whole IT needs for the agency, I can't cover it having people around the clock
Right.
awake. We're on call, but um, so some of the vendors like that, and one of the other things that I've been involved with is company providing what is called PC over IP, and we're putting workstations currently up in Azure, not in Azure, in AWS, and utilizing those for some of our mobile workforce. Because in the greater Spokane area, we have a lot of basalt, which is basically uh, volcanic rock, and the wireless carrier signals don't get through that, and
Hmm.
very well. So it's a lot of areas where we have limited bandwidth. And by utilizing the PC over IP technology, which basically just sends pixels back and forth and not really data, it's a lot faster and it's more secure because everything is located currently in the AWS cloud for us. And that's been beneficial. It's something I'm looking at expanding further. To the cost standpoint, we can utilize Chromebooks instead of providing, $1,500–1,600 laptops and
Right.
all the accoutrements that go with those. And if somebody runs into a problem, instead of having to build a new laptop, here's another Chromebook. Go do it.
Wow. That is cool. Um, I hadn't really, I haven't really, I've heard of it like in passing, but I haven't really heard about any of folks really using that yet. So that's really cool. And I'm thinking of a number of different clients where that could be super useful. So
Yeah,
that's a
it's a good solution. It's a company that started here in the Spokane area. I tend to be fond of those companies because I've helped a few kind of get started a little bit over these numerous years, and they've most of them have done really really quite well. So it's exciting to do that. And the gentleman who uh, turned me onto this, I had worked with him through another startup from 20 plus years ago.
very cool. I'll have to get the name of the company when we're done here. Um, So couple last questions as we wrap up. First would be, and it's funny because I was kind of having a conversation about telehealth in behavioral health. Because it's interesting, especially with everything you're seeing with psychiatry, and you guys are kind of different. Like this isn't the same, but like these companies kind of over prescribing medication, like, or making the ease of access, like, or prescribing ketamine, all this crazy stuff. But then in general, just from a counseling standpoint, like in my experience, the relationships with a therapist is very intimate, and trying to forge that initially over telehealth could be challenging. So the question is, regardless, what changes do you think will come in time in the behavioral health industry, or what do you think will be the biggest changes as time passes? Um, yeah,
That's a great question. And I don't think any technology ever will overcome the need in the behavioral health space for the face-to-face, for the true face-to-face,
right,
because there's subtleties that through our meeting right here that we might not necessarily catch on to, and it's a little more important for the clinical staff to be able to see that. I had a discussion with a previous medical director several years ago about telehealth, and this is years well before the pandemic. And he said, look, the difficulty is we can't pick up on a lot of clues looking at somebody through a camera. We
right,
need to be face to face with them. So I don't think there's really ever going to be anything that's going to necessarily overcome that. We have the challenge, and we're uh, defining terms now in our space where you have telehealth and telemedicine. Telehealth being picking up the telephone and talking to a client, and telemedicine having a video with them.
got
So
it.
those are a few of the things that we're kind of defining. And Washington State did a great service by providing a bunch of Zoom accounts to to a lot of clinicians throughout Washington State through the pandemic, so they could be in touch with their clients. Because initially we were in the early days of the pandemic, I mean, the very early days, we were having clients ask, "Hey, can we do this, as a video conference, and we do it as a phone call?" And then, the pandemic came, and we were fortunate to be able to move 500 staff remote within a week. And that the healthcare authority here in Washington State really helped support that with the Zoom accounts that they provided.
Well, yeah, that's very cool. Um, so last question. We like to ask, if you could go back 5 or 10 years in time, what advice would you give your younger self?
10 years in time, buy Bitcoin. No, just kidding. Um, the just that from my perspective right now, 10 years isn't a very long time.
Right.
But just that it's going to go fast. What I would recommend doing is every quarter or every year, write down notes of what you did during the year, good and bad,
Mm,
so you can reflect on it a little bit, and just kind of keep a long diary. And I would, recommend using a paper journal for that, because the mediums that I've seen come in and out over the years that I've been doing this have changed desperately. I mean, when I started, I was excited to see tape backup go back up 1 megabyte a minute, and we're a little bit beyond that speed barrier. So
yeah, I love that. I don't do that today, so that is something I think I might do starting now. So
yeah,
thank you, Paul, and thank you so much for joining us. It was an absolute pleasure having you on.
well, I appreciate it. Thanks, David.
Yeah, and to our listeners, thanks for tuning in. We will catch you all very soon. Thank you.